here. I'm here to introduce Michelle Kelly, who is the founder of POW Therapy. And I love the name. It's very appropriate for tonight with the snow, but it also stands for Place of Optimal Wellness. She's so committed to helping her patients through various means. Obviously, there's wellness that's incorporated into the name of her business, but she also provides personalized services, whether there are concierge or telehealth options for this, for sex therapy, trauma therapy, and holistic health. She's also a brain health coach. Correct me. It wasn't specialist, brain health coach, right? And offers services such as EMDR, which is very, very, very helpful and potent for helping people through traumatic experiences. And we're so excited to have her here tonight to talk about sexual health, especially during the perinatal period, which can be really like we like to say at Hive, we like to talk about the things that aren't talked about, that are very common experiences. And this can definitely have ripple effects throughout parenthood and relationships. And it's so important. So we're so thankful to have your expertise come and establish some helpful tips and tools for us tonight. So thank you so much for joining us, Michelle.
Beautiful. Well, thank you. I'm so happy to be here and to see some new faces that I've never met before. I will share that when I give presentations, I love to see faces. I'm so happy you popped on, Karen. You don't need to, obviously, if you don't want to. And I'm also open to you unmuting as well and asking questions. Like, these conversations are so much more powerful when you bring yourself into them. I mean, I can talk for hours on this topic, but I would love to have a conversation with you. You showed up tonight, so obviously there's something about this that calls to you. So I would love for you to join me in the conversation if you feel bold enough to join in. This is a topic that I'm super comfortable talking about. In terms of like what inspired me to become a sex therapist, I had been doing EMDR therapy for a long time, probably about 8 years, and just seeing how beautiful the healing was with that. And I was working at a substance dependence treatment facility, and 90% of the individuals had sexual trauma. I mean, it was high. The number was high. And so I started really working with people navigating their sexual trauma and other types of like life situations where EMDR can be really helpful. And then I started working at the Unique Foundation. I'm not sure if any of you are familiar with that. Has anybody heard of that? Okay, this is a phenomenal resource. It's YOUNIQUE. Unique Foundation. It's a local nonprofit, and all of their services are free. They serve female survivors of childhood sexual abuse. And they have they have 2 retreats. They're 5-star retreats. Like, they are luxury retreats and they're free. There's one in Utah in the mountains, and there's one in Georgia. And women have come from all over the world to go to this retreat, and it's amazing. And I used to be a therapist there. The women who came to the retreats that were from Utah, they received free EMDR therapy as long as they wanted it after the retreat. So if you or any adult women that you know have experienced childhood sexual abuse, I wholeheartedly recommend that resource. But that retreat's a 4-day retreat. And on the last day, we would do a sexual health class when the women were like finally ready to approach this topic, right? I mean, obviously we were there because all of those women had experienced sexual trauma, but it wasn't until they had been with each other for 4 days that we were going to approach sexuality as a woman and what that looks like now. And it became so apparent that there's so much healing that needs to be done in that arena, not only in that group of women, but just in general. When the individuals that I see in therapy and what they're navigating, like, these things are so common, but they're not talked about. And so people feel like they're totally alone in their experience. And so when I was working at the Unique Foundation, I was talking to these women, though, they would say, like, I've been in therapy for 10 years and I've never talked about my sexuality with my therapist. And it's like, oh my gosh, like it's heartbreaking because that's a huge part of their sexual trauma. And for many women, not all of them, but for many of them, it's manifesting in their adult life. So that inspired me to go back to school. I spent 2.5 years studying specifically sex therapy, doing tons of consultations with mentors and different things like that. So it was a 2.5 year process to get my ASECT sex therapy certification. And I learned so much. I mean, talk about what I didn't even know as a woman, okay? Like I was shocked. I felt like I had grown up on a different planet, or like there was just such a disservice. And that's when my eyes were really open to like how much we don't know or how much we don't talk about. And so it's become a passion of mine to just let the conversation be real, let the topic be out there so that we can talk about sexuality in useful, healthy ways versus all the nonsense we're getting from media and outside sources. And so, yeah, I'm super passionate about it. The brain health certification, that's kind of a totally different part of my practice. I work with the Amen clinics. I'm not sure if you are aware of the Amen clinics, but they're pretty cool. They offer SPECT scan imaging where they can actually look at your brain to see what's going on with your mental health. So for example, you can see 7 different types of depression. You can physically see it. You can physically see PTSD. So that's a whole nother topic, but that's what that's all about. If you want to learn more about that, you can find it on my website. So what I focus on now in my therapy practice is sex therapy, relationship therapy, and EMDR therapy. That's really what I specialize in. So I'm going to go ahead and jump into the presentation. But before I do that, does anyone have any questions? Okay. All right.
Okay, I have a question. I'm just curious. Were any of your professors that you learned sex from?
Oh, you're kind of cutting out a little there, Sarah. Oh, are you there?
They met or do what you guys about?
Sarah, I'm so sorry. You had cut out right when you were about to start asking your question. Will you please repeat?
Oh, sorry. I was just curious about your teachers. Were they women and men, or is this mostly a female?
The professors were phenomenal. They were all genders. Like they pretty much spanned the gender spectrum and a variety of ages. I mean, probably from like 30 to 75. Our oldest professor was a man that was 75. So we really had a wide variety of influences, which I loved. You know, growing up in Utah, I didn't get a wide variety of influences when it came to my sexuality. So like I said in that program, my eyes were kind of opened. Yeah, I don't need to go into detail about that, but the first class is called the Sexual Attitudes Reassessment, where they expose you to a variety of sexuality, like the way people that just show up with their sexuality. And some of it I was like, what? I had no idea, you know. So diversity is beautiful, and I was exposed to a lot of that, and I really appreciate that. And I believe that's something I can bring into my practice with an open heart, you know, and just allowing that diversity to be in the room, even if it might be taboo in society. It's like they need that support more than anything, to have a safe space to talk about some of these things that aren't commonly talked about or even accepted. Any other questions before I jump into the presentation? Okay, I'm going to go ahead and jump in, share my screen, share and play. Okay, so life, a journey worth taking. That is how I decided to title this, because sexuality is a part of life. You know, life is so complex. I mean, we all know, we're all living it. And I just feel like it really is a journey worth taking. And as a therapist, I'm really passionate about inviting people to do the work that's hard, because it leads to fulfillment. It leads to deeper understanding of yourself. It leads to deeper understanding of your partner or partners. And I will say in this presentation, I'll probably say partner sometimes, I'll probably say partners sometimes, because I wanted to honor all different types of relationships. I know there are many polyamorous people in our community. I want to be able to honor that as well. So you might hear me say partner or partners, referring to your present tense or maybe just past, partners as well. But when somebody wholeheartedly steps in to a space of healing and growth and learning, it is not necessarily an easy process, but man, is it powerful. I call it the excruciating path to authenticity, because sometimes we have to look at parts of ourselves in order to evolve. We have to give ourselves grace and other people in our life grace in order to allow them space to evolve. So life is a journey, and it's one that I definitely believe is worth taking. And the sexual health journey, I think, is a huge piece of that, because many people are suffering in silence with their sexual health concerns. And I believe that you don't need to suffer in silence. You deserve to have a voice and to know how to work through these things and know what resources are out there to help you. So a quote that I came up with when I was preparing this, when I think about what I see in the therapy room. So welcoming experimentation as a guiding light invites openness and curiosity. Expecting perfection and concrete answers invites frustration, hopelessness, and sorrow. Allow for grace as you learn to trust the guide inside. So as an EMDR therapist, I love EMDR because all the healing, all the perspective you gain, all the insight you gain comes from within. And that's why I love it so much, because you really are finding that guide inside and realizing that your body knows what it needs to heal. And we need to give ourselves grace as we're learning and growing, and welcoming experimentation as a guiding light. What I mean by that is, for example, when I was in the dating world, I'm no longer in the dating world, but when I would look at it as an experiment, right? I'm going to try this experiment as I date for the next 6 months. I'm going to be celibate for 6 months. I'm not even going to kiss a soul. I'm just going to see how this goes, And you start to figure out your flow, and I started to figure out who I really wanted in my life and what I wanted in my life. And as we are healing, as parents, as women, as men, I shouldn't even say men and women, I feel as all genders, as we're going through this world and healing, if we can look at our life from a lens of curiosity and openness, and we have the opportunity to grow. If we look at it from the lens of we need to be perfect and we need to have all of the answers and we need to know them now, then generally that's where people get stuck. And so I do believe welcoming those challenges in our life, like I said, the excruciating path to authenticity, what we go through isn't always easy, but it's worth it. And when we're going through the healing process, sometimes we do need to experiment and figure out what's the right path forward for us, because what works for one person doesn't necessarily work for another person. And so it's really about learning to trust that guide inside and allowing yourself to find the provider that you fit the best with. You might go to a pelvic floor physical therapist and not jive with one and feel like, I don't want this pelvic floor physical therapy. This isn't for me. And then you go to another one and you're like, oh, thank goodness, this is exactly what I need. So being able to experiment with providers and different healing modalities and different ways of just learning and growing, I think, is so powerful. So when it comes to sex and parenthood, pregnancy, maybe even infertility, pregnancy loss, there can be so much bundled up around sex when it comes to what does it mean to become pregnant, to be a parent. But something that I notice is it's really common and it's really easy when there's a problem with our sexuality to think it's the person that we're with that's causing it. Is really common to look at your partner, to look partners or look at each other and kind of project all of that distress onto your partner. And it's really not the right lens to look at it. Naturally, we're going to look at it because they're the closest to us and they're the ones we're being sexual with. But there's a lot more to the story. So when I pull up this next slide, it shows various influences on your sexual self-esteem, meaning like how you feel about sex, how you show up when it comes to sex. And I'm realizing I need to change my view because I can't read. Oh, perfect. It's fine that I can't read it. I'll invite you guys to read it. Will someone please read the first paragraph?
Are you talking about your quote?
The first paragraph to the right of the image. Yeah.
It's within our power to take a deeper look at our sexual self-esteem and consider the assortment of influences that are playing starring roles in our intimacy dynamics.
Okay, thank you. So as you look at this list, you can see, yeah, our partner or partners might have an influence on our sexuality, but what else does? Because commonly, you know, pregnancy might be one piece of that. Miscarriage, abortion, death of a child, pregnancy trauma, like those are all things that are going to be related to, you know, trying to become pregnant or having a baby, and how does that impact your sexuality? But I think it does us a disservice not to look at the multidimensional lens, like what else is influencing our sexuality? Because you might be thinking it's related to your pregnancy or your birth, but if you take a deeper look, there's probably more there. And if you don't really understand what's fueling the dissonance or the distress, it's hard to really heal it. So one of the first steps in healing is even identifying what's influencing this. What myths am I like living that are harmful? What shame am I carrying that would be useful to release, you know, and how can I claim what my sexuality really means for me? So as you look at this list, I would invite you to consider like, okay, what's showing up in my life? And then making a commitment to work through it so that you can have the sexuality that you deserve. Okay, will someone read the second paragraph, please?
Your frustration towards yourself or your partners can shift to compassion and inspiration when you fully grasp the depth of influences you and your partners have been exposed to.
Yeah, thank you, Bran. So something else that I notice when I'm doing sex and relationship therapy is that it's really common to judge your partner's sexuality and forget that they also have all these other influences that are impacting them. It's really easy for us to look at like what's bothering me, but sometimes it's easy to forget that our partners have been exposed to a lot of messaging as well. And so to be able to have empathy for one another as you're exploring this, I think is super important. And honestly, even having these conversations requires skill building, because most people haven't been taught, I shouldn't say most people, many people haven't been taught how to communicate about sex. And that is what I notice is one of the biggest problems, is couples don't even know how to broach the topic. And then let alone have the education to know how to navigate their distress. So in sex therapy, there's a lot of education that happens as well. And a lot of myth busting. It's huge. And a lot of sifting through, tender feelings and stuff as well. And if someone will please read that last one.
I can do it.
Okay.
Dedicate time to exploring and learning how to heal from these influences. This will help illuminate your path forward and create a sense of self-advocacy, insight, and purpose.
Yeah. So I really do believe there's value in dedicating time to healing these parts of self. And once you understand these influences, you really can become an advocate. And it's super powerful to be in that space, to feel like you're advocating for yourself and your sexual health versus feeling like you're a victim of whatever you may have experienced so far, Any questions as it relates to this slide?
I think one thing that comes to mind is just how it might fluctuate depending on, not just in a positive state versus a negative state, but throughout cycles of the year, even if it's positive throughout the year and you have positive perspective, certain aspects of these influences might carry more weight than others.
For sure. Yeah, I wholeheartedly agree. I mean, we can have healthy sexuality throughout our entire lifespan. Really, truly, like from when we're born. I mean, being able to understand our human body and what it's capable of and what it can do for us, and just understanding it in a real, I think we can do our children a lot of good by educating them about these topics starting at a really young age. There's an organization called Defend Innocence. I'm not sure if any of you have heard of that. It's defendinnocence.org, and they have sexual health education from basically 0 to 18. It's awesome. So it's age appropriate sexual health, and there's a variety of stuff like that online that's just really, really useful. But for many of us, our parents weren't necessarily taught how to teach us, and this generation, I think, is more open about sexuality. And so there's a lot more resources out there now, which is such a blessing if you're feeling like you need support and like, how do I broach this topic with my child or my spouse? It's nice. There's a lot more out there. But when we're, a child all the way up through our death, we can have healthy sexuality throughout our lifespan, but that's always going to look different. Just like Joanna was saying, it's like, we're going to evolve. There's going to be flexibility there. Certain things are going to impact us more at certain times than the other. Anything else? Any other thoughts or questions? Keep my eye on the time. Okay. So moving on. Sexuality is on a spectrum. Honor differences. So this is something that I see commonly in the therapy room, is that partners will be afraid maybe of their sexual differences. Again, this comes back to like us not getting the education we needed about sexuality growing up. So we have a variety of influences that impact what we believe sexuality should be, or how we experience and express our sexuality. But the truth is, sexuality is on a spectrum. On this end of the spectrum, there might be individuals who are experiencing asexuality. And although I'm saying asexuality is on this end of the spectrum, there's also a spectrum within asexuality. But to keep it simple right now, somebody on this spectrum, or at this end of the spectrum, might just not have interest in being sexual with another human being. They might want to be in an intimate relationship and have closeness and have love and have companionship, but they're not interested in sexuality. They're not interested in sexual intimacy, I guess you could say. But again, there's a spectrum within there, and that can vary. This end of the spectrum would be harming another human being for sexual gratification, and that's never okay. And then there's everything in between. And it's exceptionally rare that you find a partner or partners where you guys are the exact same spot on that spectrum. One of the most common reasons people come to sex therapy is because there's desire discrepancy, meaning one partner might have higher desire than another partner, and they don't know how to navigate that. They don't know how to talk about it. And commonly, it's talked about in their language that someone's defective in that scenario. But the truth is, no one is defective in that scenario. They're just different. But that's not what our society teaches. And so that's not the angle that people approach it with. So I believe the conversation has the ability to shift to seeing the diversity in our sexuality, so that we can have greater compassion and empathy for our experience and for other people's experiences. And I'll tell you what, that takes some skill building, because there can be a lot of tenderness and a lot of hurt feelings and stuff like that can occur when there's desire discrepancy and patterns that you can get into that can make it really hard. And then you bring in pregnancy, and then you bring in childbirth, and that adds a whole another element to it, right? I mean, everyone's experience is going to be different, but it is common that the desire for sex shifts and evolves, particularly right after giving birth, or even during pregnancy, or if you're experiencing infertility. or pregnancy trauma. I kind of smiled when I said infertility because, to be honest with you, I'm trying to have a baby right now. I'm 42 and I've never had a child. And I never thought I was going to, because I didn't want to have a child with somebody I didn't want. I wanted to make sure whoever had my child with me, I wanted them to be my co-parent. And quite frankly, I had never been in a relationship with a man where I felt like I wanted them to be my co-parent. So I never tried. And now I married an amazing man and I'm 40 and I'm like, oh my gosh, okay, we're going to do this. And apparently we're not, you know? So my latest prescription from my naturopathic doctor, she's helping me track my hormones and stuff. We're doing a variety of things, but she said, you need to have sex 2 to 3 times per day during your fertile period. And I'm just like, no way, like that's not going to happen, you know? So what does sex look like when you're trying to even conceive? Like it can change your relationship with it. And I'm laughing about it and I'm smiling about it because I'm in a place of acceptance with what happens, but for many people, it can be exceptionally painful. Like they can have a history of loss and like it can be so hard. And so it just affects sexuality, that whole process, it does, you know. My poor husband, he couldn't get an erection anymore because he's a young buck, but he's just like, I'm out. I don't have any more to give, you know. So that's what when I say we're going to be real on here, we're going to be real, because if we don't learn to be real with these topics, then we're not going to heal. So anyway, it can mess with the dynamics a little bit. Okay, so moving on. During this section, I'd like you to really take some time for self-reflection and see what comes up for you as we're going through this. I always say all information that comes up is meaningful information. Sometimes it's going to be like an aha epiphany. Thank goodness I needed to hear that. Other time it's going to be like a dagger in the heart, like, ooh, that's an area that I didn't really expect to be triggered by tonight, you know. And I think remembering that all information is good information, because it's telling you a story. It's saying this matters. It's saying give me attention. So as we go through this, I'd say notice what's coming up, and if you need to ask questions, please do. And then if you need to jot it down to say, you know what, I need to come back to this later with my therapist or on my own or with my partner, whatever that looks like. But as we go through this next section, really see how it relates to self. So when it comes to sexuality, I believe there are 4 really important foundational stepping stones. And those are to be able to achieve a sense of safety, comfort, confidence, and pleasure. So up top, you'll see it says Liberated Intimacy Essentials. I have a course that I teach. It's called The Path to Liberated Intimacy. Therapy is not cheap. And I have a goal of creating high or just like really good quality education with support at an affordable price, because not everybody needs therapy to work through these stuff. Some people just need support and guidance and education. So the Path to Liberated Intimacy, it's beautiful. It's 9 weeks of education, and then it's 10 weeks of group coaching where you can come in and ask questions and really learn and do some deeper work. And it's like $397 for 28 hours of lessons, whereas individual therapy is $175 an hour, you know. So you'd save a lot of money by doing a course if you don't need therapy. Sometimes people need therapy, but that's what Liberated Intimacy is, if you're wondering. So in that, we talk about those 4 foundational stepping stones, because if we don't identify the hurdles that are within each of those areas, it's harder to heal. So it can kind of help guide your healing process if you can identify what's showing up for me where I don't feel safe sexually. Where am I not comfortable? Where am I not confident? What's interfering with my pleasure? So we'll dive a little bit deeper into that now, unless anybody has any questions first. Okay. So as we go through this, again, like I said, just notice what comes up for you. We're going to start with factors that might influence your sense of safety. So a history of sexual trauma and not knowing how to approach or heal this. When I worked at the Unique Foundation, so many of the women said, I thought I had healed my sexual trauma. I really did. Like, I thought I had made peace with that. And then I had kids and it all came back up to the surface. So I'm not sure if any of you experienced that, but it's a really common experience. And it's one that I think we should talk about. Being influenced by a sex negative culture or family and experiencing shame, anxiety, or embarrassment around sex. So cultural influences are huge. If you grew up in a family that's sex positive, you learned about your body, you were able to talk about just all types of different things as it relates to sex and relationships, you're likely not going to be experiencing the same shame, anxiety, or embarrassment that someone might have if they grew up in a sex negative culture. So that's really important as well. Feeling pressured or obligated to have sex, or you or your partner sulks or get angry if you say no to sex. So this one's big. This one comes up in almost every sex and relationship counseling session I've ever had. Like feeling pressured or obligated. The problem with pressure is when someone feels pressured to have sex, pleasure takes a nosedive. If someone's experiencing pressure, you're not going to be in the mood. You're not going to want to experience pleasure, right? So the dynamic that I see a lot, and this can get tricky after having a baby because there's so many demands on you. I mean, so many demands. You're tired, you're exhausted, your body is healing. You just need your space. I mean, there's so many things that can influence this. Sex might be the last thing on your mind. But if you or your partner sulks or get angry when one of you is initiating sex and the other sulks or gets angry about it, it basically shuts down the possibility for you to say yes wholeheartedly in the future. So one of the things I teach my clients is that it's so important to be able to gracefully receive a no and to honor that that person's not in a space for it. Because if it's safe to say no, and if it's safe to say no every single time, not just sometimes, it's safe to say no every single time, then it opens up the opportunity to say yes. If it's safe to say no, it's going to be safe to say yes. If it's not safe to say no, it's not going to be safe to say yes. And that's a really tricky dilemma, but I'll tell you what, I don't think there's been one client that we have had this conversation about that they've been resistant to this concept. They've all been like, oh, that makes sense. And then they make the shifts, and then sexuality becomes a safe topic, you know? That's one of the most powerful things I see. But any thoughts or questions about that? Okay. Non-consensual sex. So essentially this is sexual assault, you know, and yes, this can occur in relationships where you wouldn't think it should, you know. I mean, I don't even know if I like that statement, how I said it, because the truth is it should never happen, but it does. And so obviously you're not going to feel safe if you're experiencing non-consensual sex. Being made fun of or shamed when expressing your emotions, thoughts, needs, preferences, desires, or values. So a lot of what I do in sex and relationship therapy is creating the safe space in the therapy office for people to learn to be able to express themselves. How do I feel about this? What are my thoughts about this? What are my needs? What are my preferences? What are my desires? What are my values? And how does that conflict with yours? And to be able to look at that in a really compassionate, objective way, because it's really easy to become defensive or to feel defective when there are differences. And so a huge part of the therapeutic process is being able to see your partner or partners from a really human lens and understand they're going through stuff too. And the more you can really get to know each other, the better outcome you have. And that's hard work, and it's worth it. Complications with your pregnancy. So your provider might tell you to avoid sex if you're having unexplained vaginal bleeding or leaking amniotic fluid. So there are a variety of reasons why you might need to stop having sex while you're pregnant. And so those are important safety precautions as well. You don't want to push through something when it's potentially dangerous. Not giving your body time to heal after giving birth, particularly if you experience tearing or an episiotomy. If you engage in sex before your body is physically ready, you can get infections and, exacerbate your pain and different things like that. And there really is no concrete timeline of when it's safe to have sex again. It's really a matter of like learning to listen to your body, talking to your medical providers, and coming up with a plan that feels right for you. And something we're going to talk about coming up is broadening our definition of sex, because as a sex therapist, I don't view intercourse as the only means of sex, Being in an abusive relationship is not going to create a sense of safety sexually. Not having adequate safe sex or sexually transmitted infection knowledge or practices. And exploitation. So this is when a person leverages power or control to get sexual gratification. So sometimes in relationships, this can look like humiliation. It can look like threats. I mean, I've heard it before. If you don't have sex with me, I'm going to go find it somewhere else. It's a threat, and that energy, it's possible to work through that energy with help. And using sex as a commodity. So sometimes that happens in relationships as well. Like, I'll have sex with you if you clean the kitchen. But man, wouldn't that be nice? And you know what? There is some truth to that. I don't know if you guys have heard of the book, Come As You Are. Oh, okay. I recommend getting it. It's called Come As You Are by Emily Nagoski. Nagoski, Come As You Are by Emily Nagoski. She talks about a dual control method is what she calls it, but it's basically if you're driving a car, right? We've got accelerators and we have brakes. So sexually, we all have accelerators, things that are going to make us want to approach intimacy. And then we have brakes, things that are going to make us want to avoid intimacy. So I kind of laughed when I was talking about the kitchen thing, because for many people who take the burden of the household chores, somebody doing the dishes is gonna be an accelerator. It's actually like, yeah, you do the dishes. Yeah, baby. Okay, well, I'm gonna give you some tonight, But that's a different energy than sex as a commodity. Using it as a commodity is more of like there's more kind of icky energy with it. I think you could feel it it's kind of hard to describe, but it's almost like trading, if you buy me this outfit, then I'll have sex with you type of thing. That would be more of a commodity. That's not necessarily like a safe mutual relationship. But I should say, for some people, they can actually navigate that and be quite happy with it. What I mean by that is there is a whole culture of like having sugar daddies, and that's usually viewed as very ethically wrong. But the truth is people are finding great satisfaction in it. So when I was talking about that diversity, it's almost like strengthening your compassion muscle and being able to see that there's such a variety of ways of expressing your sexuality. And what matters most is it's aligning with your value system and it's not harming other people. So there's caveats to a lot of this, I guess, is what I'm saying here. When sex is void of communication, and this is a huge issue that I see in sex therapy as well, when individuals just don't know how to have the conversations. Like most of us weren't taught how to have these conversations. So it can be really hard, and timing matters. And like, sometimes you really truly need a therapist just to guide you in those learning phases of how to even communicate about this. So before I move on to comfort, anything that comes up for you or anything you have questions about as it relates to safety? And these are just some ideas. I mean, I imagine as you look at your own life, there's others that come up for you that aren't on this list. Okay, keep my eye on the time. I'm going to keep moving forward. I'm going to go a little quicker so we have time for questions. So factors that might influence your comfort: inadequate lubrication, thin vaginal tissue, loss of elasticity in the vaginal tissue. So low levels of estrogen after you give birth and while you're breastfeeding can almost mimic perimenopause. So you are likely going to need lubrication. And the truth is, all of us women have different levels of lubrication. So it's really nice to have it regardless commonly, but sometimes you're really, really, really going to need it to have comfortable intercourse. And even just, comfortable external play as well. So keeping that in mind, your hormones are shifting and changing during this time in your life, and it can affect that. Painful intercourse. So if there are wounds that are healing, scar tissue that isn't pliable, infections, there are, for most people who experience painful intercourse, there's a way out. There are treatments and there are providers you can see to help you through this. And I recommend it because you deserve to have pleasurable experiences. Experiencing pelvic or abdominal pain isn't uncommon during and after pregnancy. Mental health struggles are really a powerful influence when it comes to sexuality. And it's one that I think commonly gets overlooked, but it really matters. I mean, think about the life changes that are occurring and how that might impact you. I mean, it might even be, postpartum depression or any other postpartum mental health concerns, or maybe you had some prior to pregnancy, or it just kind of hit you after in a way you never expected. And that can really impact your comfort level just wanting to engage in sexuality at all. Fatigue is huge. It's going to be hard to have this comfortable, pleasurable sex when you're just exhausted. It's just like, no, leave me alone, Dissociating during sex, if you're experiencing pain or trauma or distractions, this is a really common phenomenon that a lot of us don't really talk about. Needing to disconnect from your body if you're experiencing pain, or if you've had trauma and sex triggers it, or commonly just even having a task-oriented mind where you can't quite get out of your head and you're distracted, you're kind of dissociating from the moment. You're not necessarily comfortable with the experience because there's other stuff going on. Trauma before, during, or after pregnancy can get triggered during sexual intimacy. It's really common for triggers to show up during sexual intimacy, so keep that in mind. Not knowing how to express your boundaries, or having a lack of assertive communication skills. So we might be uncomfortable with our sexual experiences, but not know how to talk about that. Feeling disconnected from your partner. And I would even probably add feeling disconnected from yourself, because there's so much change going on. It's almost like you feel like you're losing parts of yourself sometimes, So feeling disconnected from yourself or your partner can impact your comfort with sexual intimacy. Oops. As I go back through these, I accidentally went back. Does anybody have any questions about this part? Okay. So what's going to interfere with our confidence sexually? Body image can impact a reluctance to engage in sexual intimacy. I mean, I can't even tell you how many individuals I meet with where they're self-conscious about part of their body and it's influencing them wanting to even have the lights on, or even to be seen, or even to be touched. This is a powerful piece to sexual intimacy, because the goal would be that with liberated intimacy, you can really feel safe having any part of your body touched without feeling like you have to, don't touch my belly, or like, oh, don't look at my scars. And you deserve to be in your body and embrace it. And so if you're struggling with that, I would encourage you to get some support with that, because you deserve it. Performance anxiety, embarrassment, getting in your head. When we haven't had a lot of good sex positive education, we can show up with anxiety or embarrassment, or just getting in our head about, am I doing this right? Am I doing this wrong? It is so common. What we see in the movies and what porn portrays is not a very good representation of sexuality. You know, to be quite frank, in the movies, it's showing the men like pounding the women and the women like, yes. Most women do not feel that way when it comes to that type of penetration, but that's what we see in the movies all the time. And the men, and I'm generalizing, I'm in the binary right now, okay? I'm going to admit to that. Don't know either. They don't know either, many of them, and they need education. There's another really beautiful book. It's called, the title's wonderful. It's called Becoming Cliterate. Have you guys read that? Isn't that a great title? It's so important. It's so important. It goes in depth about our female bodies. And there's a chapter in the end just for the men partners so that they can get the synopsis, but they can get the point at the end. You know, they have to read the whole book, but please read this chapter. And she's funny. The author is funny, but it's also really meaningful conversation, because most partners really do want to please you, but we don't commonly have the words for it, and they have no idea. So sex education is failing us in our world, but it is improving, luckily. So that's common, to have anxiety or embarrassment. Not knowing how to talk about sex with your partners, we've mentioned that. Infertility distress can impact your relationship with your sexuality and your confidence. Pregnancy loss can be so painful and disheartening. Sexual shame is going to impact our confidence. And that can, if you go back to that list of influences, any of those things can influence sexual shame. Not knowing what you enjoy sexually. Maybe you grew up in a culture where it wasn't okay to necessarily like explore your own body, and it's really hard to know what you enjoy if there's not a sense of like freedom to figure it out. And that can be hard if you're single and your belief is that you're not allowed to touch yourself. It's hard to kind of sort through that and figure it out. So I believe we all deserve to go down the path of figuring out what it is that we enjoy. And I'm talking about the whole body, right? Not just the genitals, because yeah, that's part of it, but your collarbone might be so lovely to be touched, you know, and I believe that that should have just as much weight as touching a genital. So it's like really allowing your whole body to be in the experience. And there's just some really cool activities you can do to get to explore your own body and with your partner as well. And commonly a sex therapist can guide you in that. Not having the communication skills to share what you enjoy. So you might know what you enjoy, but you try to share it and your partner gets defensive, and then you just stop telling, you know, that individual what you want. Because they can't be receptive to it. So sometimes people need support and guidance, again, with that communication. Comparing yourself to others or media representations of sexual intimacy. So the goal would be that you actually get to a place where you're not comparing yourself to anybody, but you're allowing yourself to be embodied, be in your body, tune into what you enjoy, not what anybody else thinks you should. And that might change during and after pregnancy. In fact, that changes throughout the lifespan, you know, so learning to be okay with those changes, I think, is really important. Cultural influences projecting that your relationship or sexual intimacy desires and preferences are bad. So our culture can project this is good, this is bad. And if we don't fit in good and we're viewed as what our relationship structure is or what I desire or what I prefer is bad, then we're likely going to not like be at peace with that. And we deserve to be at peace with that. And sometimes that can be really, really scary. For other people, they can step right into that space and they'll say, this is me and this is what I love and beautiful. You know, I love kink. Okay. For other people, it's like, if I tell my partner I enjoy this kinky thing, like they're going to divorce me. You know, so there's varying levels of vulnerability that are involved in this, and it can be really scary. Okay, we're getting close. So I'm going to speed this up. What can impact our pleasure? Difficulties with arousal or orgasm. So pain, fatigue, anxiety, body image, lack of knowledge, all those things can be influencing that. Postpartum mental health and related medication might reduce your sexual interest and pleasure. Breastfeeding may suppress sexual desire. And you guys, I'll give copies of this. You guys can all get copies of these slides as well, if I'm kind of rushing now. Fertility or pregnancy complications, shifting your relationship with sexual intimacy. Not exploring or understanding your personal pleasure and or the pleasure of your partners. Sexual dysfunction might be present. And I will say, I personally believe the DSM is biased. So yeah, these symptoms might be present, but most importantly than like putting yourself in a box of the DSM, which is like a diagnosis framework, really look at treating the underlying influences, what's leading to this. And a limited definition of sex. So if we can expand our definition of sex and realize it's not just intercourse, I mean, we can learn that we can experience pleasure in so many different ways. If you're dissatisfied with your relationship, it can interfere with pleasure. And when there's desire discrepancy and not knowing how to navigate this, we talked about this a bit. And then when there's a focus on performance versus pleasure, man, I could spend a whole hour on each of these topics practically. So pardon me for having to rush through them to stick with the time. So this is a trail worth taking. I believe that we deserve to have liberated intimacy, meaning the safety, the comfort, the confidence, and the pleasure. So the resources that I have, the offerings that I have related to this are here. So you can refer back to this slide if you want to know. The Path to Liberated Intimacy is that course I was telling you about. It starts January 8th. It's the lessons are every other Saturday from 9 to 11 a.m. Everything will be recorded. So if you can't join live, you can still have access to the information. And then the group coaching sessions are on Thursday nights from 7 to 8 every other week. So if you're interested in doing a deeper dive, but you don't necessarily feel like you need therapy, this can be a really good option. And then these are my therapy rates as well, if you're interested in that. And I don't accept insurance, just so you're aware. Concierge therapy means I go into people's homes to do therapy. I currently don't have any of those appointments available right now. And I only have like 2 or 3 telehealth slots available right now. So if you're interested, I'd recommend reaching out soon. And then pelvic floor physical therapists, when you go through that intense process of pregnancy and giving birth, this is a resource that our culture doesn't promote enough, but that can be just such a lifesaver. So these are 2 physical therapists that I know personally. That's why I'm putting their resources on here. I imagine there are other incredible pelvic floor physical therapists. I just haven't met them yet. These are the 2 that I work with most frequently. So I just wanted to share those with you. And that's it. Okay. We did it with 2 minutes to spare. Any questions or thoughts or insights?
Well, I thank you so much. I do think that there's more to unpack here. So I totally appreciate your willingness to maybe come back. I'd like to talk about like expanding the definition of sex, even if it was just, I think that's really interesting. I don't have any specific questions, although I just wanted to say I'm so happy you were able to like take questions along the way. And I do invite if anyone has another question, we, do have 2 minutes, but I love your style, Michelle, and I just really learned a lot. So thank you so much.
Good. And I see Perry has a question. Can you say what EMDR is? So when I do therapy, it's usually a 45-minute explanation just of what it is, right? So EMDR stands for eye movement desensitization reprocessing. It's the mouthful, but I guess like if I was to sum it up, I would say our body stores memory in at least 4 different ways, right? We store memory in images, if we can see. I'm not sure what it's like for the blind if they have images. It's probably different for everybody, but images, thoughts, how do I think about this memory? Emotions, what are my emotions about this? And body sensations, how does my body feel when I think about this? So EMDR therapy allows us to process all the different ways that we store memory. So talk therapy can commonly keep us in a very cognitive frame of mind, so we can talk all we want, but we still feel like shit. Sorry for swearing, but I say it because people can be in therapy for 10 or 20 years and they're still talking about the same stuff, right? Where EMDR can let your body really truly process and make peace with it. And there's so many other modalities that can do that too. That's one that I really connect with because I've seen such beautiful results with it. So if you want to learn more about it, you can go to emdria.org. There's a lot of research there.
Cool.
I wish we had more time. Okay, well, thank you, everybody. I'm so happy you came.
Thank you. Thank you so
I do
much.
have
Thank you for
one
coming out.
question just about your group sessions. Does do you focus on the perinatal period at all?
No. So there isn't a particular, so each week there's 3 topics. So there's a total of 27 topics because there's 9 weeks, right? And there isn't one specific to perinatal health and sexual health, no. But I believe that all of it kind of wraps up into that. So my goal is that people can bring their personal experience with their sexuality and still gain a lot of benefit because the lessons are going to apply to a variety of different situations. Yeah, it's basically equipping you with, there's 3 phases: exploration, inspiration, flow. Go to academy.fierceandfree.org. It's on the slides if you want to learn a little bit more about what that looks like. Yeah. Okay, well, thank you.
Thank you, Michelle.
Thank you for sharing. Thank you for showing up. And I wish
Okay.
everyone a beautiful night and happy holidays.
Yeah, and happy snow day.
Yes.
Okay,
Thank
see
you.
you later.
I hope you get pregnant.
Oh, me too.
Sending good
Yeah.
vibes.
Okay, who should I email the slides to?
I'll follow up with you.
Okay.
So that would be great. I'll send you a note. Yeah. Thank
Sounds
you.
Thank you so much.
It was
See
such
ya.
a pleasure. Bye.
Thanks.